Hey everyone, Dr. Bob Rowe here. Just a short explanation of what has happened to our healthcare system in the US and the world, for example. Basically, it's a Rockefeller takeover of the healthcare system. I'll leave some links to another area where you can find more information, but basically, Rockefeller got all his money back in the early 1900s when he basically took over the oil delivery system. He did that by hijacking the transportation of oil, and when other producers of oil couldn't compete with his cheap transportation systems, he bought them all out, took them all over, and eventually became multi-millionaire, billionaire, and took over a major part of all of the delivery systems in the petrochemical area. So, by taking over the whole system, he basically had everybody at his mercy, and eventually it was broken up, but it was actually more to his advantage. Again, I'll give you some links to where you can find more about that. So, the good thing about being in charge of all the petrochemicals is that scientists at the time were figuring out more uses for petrochemicals, and one of the things was drugs. So he decided that he wanted to take over the whole healthcare system and have everybody take his drugs so that he could benefit from all of that. He did similar things to agriculture, but let's look at the healthcare system, which turned into the medical care system. So the only problem that poor Rockefeller ran into were there was too many other medical schools. There was so many natural schools that they were actually probably doing better than and were more popular in America at the time. So most of the doctors in the medical colleges were basically natural approaches. So he wanted to know how is he going to do this. So what he did was he went to his good buddy Andrew Carnegie. And Andrew Carnegie had some great suggestions, and what he did was he sent one of his famous men from the Carnegie Foundation to go in and to basically take over the whole healthcare system by making sure people thought that the only really way to go was in the modern allopathic system or the modern pharmaceutical system that was based on petrochemicals and the oil industry, so Rockefeller could take over. So when Flexner came in, he just basically wrote up a report that said that all those other colleges, they're just no good at all. They are not scientific. They're not well-founded. So what he did was he suggested in his report that all of these programs should be shut down, that they should be kicked out, and the only thing that should be left is these modern medical colleges, obviously unfortunately funded by Rockefeller and Carnegie. So they set up foundations, and Carnegie was good at that. And because the Flexner report condemns all natural reports as unscientific, what they did was then the next thing they did was they promoted all the allopathic schools that were using chemical medicines. And so Rockefeller created this foundation, and he started donating millions and millions of dollars to the universities willing to support allopathic medicine and, of course, his drugs. So what happened was, from there, he then created state boards. So then, if you wanted to practice healthcare in any form in that state, you would have to pass the state boards. Unfortunately, the state boards, are all taken over and run by allopathic medicine. So they made sure that no one else is going to pass. So what happened was the majority of all of the non-allopathic or drug-oriented, pharmaceutical-oriented schools, they closed down. He even was responsible for getting rid of hemp, because hemp was a big contestant in the world where he was, because it meant that it would get in the way of his petrochemical industry, and it could be used for a lot of things that would then take away his profits. So he ended up shutting that down too, of course, with his buying up of the politicians and taking over the political system, which is still going on today. So the modern allopathic model of disease is that one disease, one treatment. So you name the disease, then you have a treatment for it, which is a medical drug, a pharmaceutical drug, which Rockefeller gets a big portion of. And so he has a medicine for every disease, and they don't want a cure, they want basically ongoing treatment. So if you take a look at what we're doing today, the allopathic medicines for our most popular diseases of type 2 diabetes, you have to take that medication for the rest of your life. Oh my goodness, you've got high cholesterol, you'll have to take statin drugs for the rest of your life. It was totally been proven also. And if you look at what's really going on in the healthcare system, these are not my stats. Go ahead and look at Death by Medicine. It's on YouTube. Dr. Gary Null, great documentary. A lot of the stats are showing that what's happening is close to 800,000 people per year are dying because of pharmaceutical medicine, the allopathic medical system, and that's the right drug for the right disease at the right time for the right person. And they can't work because they can't be individualized, and that's all well known. So the profits for the pharmaceutical companies are in the billions, and they have the biggest political lobbies, and they control pretty well all aspects of healthcare system. The FDA, the CDC, I could go on and on and on, but that's basically where we are. That's what happened to the healthcare industry. The big problem is that the healthcare industry has gotten too big and under one control, and that is called the institutional problem. And if you look at the other videos we have on the institutional problem, you can understand that they can't make changes from within. So basically, they're stuck with the system they have. And we know that if that system's stuck, a better system will come out and take over. So the new system will basically have to be as effective, actually solve the person's health problem. And it has to be non-toxic, body-friendly, and it has to be inexpensive, which alternative approaches are inexpensive compared to the allopathic system for any of their therapies. And it should be open source. And for sure, you can pick up all kinds of ways to learn alternative approaches, or what I like to call the comprehensive system rather than the alternative system, because there's a lot more involved in it. And the new system will be similar to the apprentice system. You'll learn from the practitioner and be really good at what you do because you followed a master at the particular system. And there are so many systems to choose from in this other system, the alternative system. And if you look at Wikipedia, they have listed over 190 different alternative systems. Funny thing is, if you ask any neuroscientist, if there are two human beings the same on the planet, they'll say that's impossible. They can't be. All our genetic experiences are all different. All of the science says that we are all individual, and we're all moving to the individual healthcare model. So that's what alternative systems are basically tailored to do. That it will bring a unique approach, and there's so many more of them. So that will be the system that's taking over the basic medical system we have today. Thanks for your attention. I hope you enjoyed it, and look for some references in the along with this video.